My name is Gerry Trillana, and my job title is Clinical Research Facilities Matron. I started into nursing back in the Philippines, where I trained as a nurse. I started working in public health in international organizations such as the World Health Organization, and then I migrated here in the UK and got into a frontline nursing healthcare job. My job as a clinical research facility matron entails setting up different clinical studies and researches. So that means looking at how to resource different clinical trials, looking at the patient pathway, how they move into the trials, and providing direct care and support to patients who is going to a clinical trial or participating in clinical research and their families. I love my job because it's a very exciting field of nursing practice, because you get to meet patients and individuals, and you get to be part of their treatment journey, and in many cases you provided them an opportunity and options to access treatments that will not be otherwise available to them in the NHS. So in the clinical research facility, a lot of our clinical trials at what we call early phase clinical studies. That means that the patients that we get have already exhausted all the treatments that they can get from the NHS, and through this clinical trial, we get them, so we expand their options for treatment and care. So, and that's very exciting. And then it's so rewarding when you see a clinical trial, new drugs are being discovered, there are improvements in the patient care. So it's not always drug, it can be an equipment, it can be a service. So through clinical trials, you get to improve the treatment and the care of the patients and their family. Obviously, I'm very passionate about the clinical trials, because what we say is the clinical trials of today is the future of the treatment and care for patients. So I will never stop raving about the potential benefits of clinical trials. So and also there are some studies that suggest that even patients who are in clinical trials do better generally compared to the standard of care, because when you're in a clinical trial, you get seen more by the healthcare team. You get to access more specialist care and treatment. So even if they don't get the actual treatment, they have a lot of benefits from it.